This is a case of a large right-sided skull-base meningioma extending from the middle cranial fossa posteriorly over the petroclival edge with a small infratentorial portion. You can see the MRI now and the meningioma in green and a temporal lobe cyst in blue. Now we're activating the fused CT and the MRA in red and the sigmoid sinus and the tentorium in yellow. Now cropping the CT, exploring all spatial relationships. And now we are turning the patient into a intraoperative position to simulate a retrosigmoid approach to evaluate the accessibility of the meningioma from this surgical corridor. You can see the meningioma under the tentorium in yellow, and you can also see the tumor being medial to the internal acoustic meatus. Now we are simulating the main surgical access through the middle cranial fossa, extending anteriorly into the pterional area. Now zooming in along the actual surgical trajectory, which is subtemporal, making use of the space which was given by the temporal lobe cyst. And now we're simulating roughly the removal of the lesion, which could all be done in a subtemporal fashion. And we're now removing the tentorial and infratentorial part of the lesion, zooming in, and now we're simulating the bone drilling of the temporal bone, staying lateral to the petroclival fissure, which contains Dorello's canal and the sixth cranial nerve. Now seeing the infratentorial part of the lesion behind this petrous bone, which we have just drilled, being left over. And we're now going to remove this part along the bone drilling bit, which we have just simulated. Seeing parts of the ICA below, now turning, and we can see that only small parts, which could be some dura enhancement of the meningioma, is left over, and the bone drilling lateral to the petroclival fissure, as we have simulated, would be sufficient from this subtemporal approach to remove the meningioma entirely, including the infratentorial posterior cranial fossa part of the tumor. Now we are measuring the extent of the bone drilling required to access the posterior part of the lesion. The surgery was carried out according to the plan, and the tumor was removed gross totally.